Welcome to a special 3-part series of the Compliance Advantage. We are tackling one of the most common objections that we hear from healthcare CEOs. We don't have a budget for compliance. Over the next 3 episodes, Ross Ronan breaks down exactly how smart healthcare leaders think about compliance investment, not as a cost center, but as strategic protection for the profits you've already earned and the growth you're working towards. In this first episode, Ross addresses what's really happening when executives say they can't afford compliance. You'll discover the hidden costs of not investing, from direct financial penalties to operational disruptions and reputational damage. Ross shares real-world examples, including a powerful story about acquisitions gone wrong, and introduces a perspective shift that changes everything. Let's dive in as I sit down with Ross to tackle these tough questions.
Welcome to the Compliance Advantage podcast. This is where healthcare executives transform compliance from a burden into a strategic asset that drives both growth and peace of mind. I'm your host, Ross Ronan, founder of Ronan Healthcare Compliance and a healthcare compliance strategist with nearly 30 years of industry experience. I'll help you stay ahead of evolving regulations while building the sustainable, compliant organization that lets you focus on high-level strategy and exceptional patient outcomes. Remember, compliance pays dividends. Invest today. Welcome back to the Compliance Advantage. We're picking up on season 5, right where we left off, to talk about compliance in healthcare and what is working these days. Today, I'm joined by our podcast producer, Cami Reyna. I'm here to talk a little bit more about compliance, so I hope you enjoy the episode.
Ross, it's good to be back. We often hear we don't have a budget for compliance. More than almost anything else, what's actually happening when a CEO says that to you?
It's funny because we do hear that quite often. And what I typically interpret that as being is that they're really saying, we see this as a cost center and I don't have the funding to have another cost center within our organization. Can't somebody else do it? Can't we just incorporate it into the CFO's work or the COO's work or the general counsel? I don't need to expend more money on compliance. And what's really happening is they don't see it as an asset or an advantage. They see it as a cost center. And when you see anything as a cost center, whether it's your private life, it's your business, it's whatever, you really think twice about those costs because you want to essentially exclude those from your expenses because you want to have more money in your pockets, and I completely understand that. Compliance is like insurance. It's one of those things that you need to have, and the ROI on having insurance is tremendous when something goes wrong. When your house burns down, you have a flood in your house, something that would cost you tens of thousands of dollars, maybe even millions, is now costing you $500 or $1,000 in deductibles. So when you're looking at compliance as a cost center versus something that's more of an asset to you, it really becomes more of a burden. The reality of it is they're spending the money anyways. They just don't know it. When you have a UPIC audit, when you have an anti-kickback statute analysis that's going on, the first thing that you do is you go out and you hire counsel, or you go out and hire a consultant, or you go out and hire an auditor to be able to handle those issues that are going on. Well, they're already an issue that's happening that you possibly could have prevented in the future. And now you're sitting there spending this extra money, having it done really fast as opposed to being proactive and really spending that money up front. So when you think about it from the standpoint of, am I really saving money by not having a compliance program? You're really not. And you're spending the money anyways. Typically what we see is it takes 10 times the amount of money and resources to fix a problem than it does to actually prevent it from happening. I got a great story. We just finished with the holidays and had all of our adult children over to the house. One of my sons came up. He was staying in one of our guest bedrooms and said, "Hey, we just saw that the toilet was leaking." And I went upstairs, and this is our last day here, and I looked at it, and I'm like, God, I've done a lot of plumbing in my life, believe it or not. And I looked at it, and I said, that's a weird place for it to be leaking from, but I'm just going to turn it off and see what happens. So they leave. Next day I come in, look at it, it's all dry, turn the toilet back on, flush it a few times. Doesn't seem to be leaking. Great. Well, about 5 days later, we see a big hole in the ceiling where the toilet had leaked through into the ceiling. And now we literally have mitigation that we have to tear apart the wall, tear apart all the tile, tear apart everything that's happening. How does that relate to having a compliance program and paying for it up front? It's going to take us 10 times the amount of money to fix this problem a week and a half later, when I could have just tore up the toilet, saw what's underneath it, peeked it, looking for problems that could be there with some red flags. I could have saved tens of thousands of dollars on this leak without tearing apart my ceiling and just have it fixed with a new wax ring that would cost me about $5 and about maybe 45 minutes of my time. It's a great example of compliance and coming afterwards, trying to fix a problem that's going to cost you 10 times the amount of money when you could just do it up front, bite the bullet, pay for it, get it done, look under rocks, figure out what your problems are before you start going down that road. So anecdotally, that is a great story on compliance, and literally that just happened over the holidays. When you think about compliance, you don't want to think about how much is it going to cost me. What you want to start thinking about is how much is it going to cost me to not have compliance. That is the biggest cost expenditure that you can do, and it's really not that expensive to put a compliance program in place. The DOJ in 2024, they recovered over $1.6 billion in healthcare fraud and abuse. It's a tremendous amount of money that people are spending, their money that they have earned, the money that they have potentially rightfully earned from providing health care and providing great patient care that they could have kept on their own. The average False Claims Act settlement in the United States can range from $1 million to small companies up to $40 to $50 million. That's a lot of money on one claim that could have been prevented or may have been prevented by an active, effective, proactive compliance program that you put into place.
So when you hear that objection, how do you help them reframe their thinking?
Well, the first thing that I do is I sit down and I go, okay, let's talk about your revenue, your annual revenue. What is it across the board? Where are you at? Then I say, of that annual revenue, how much of that is government payers? Because literally government payers are the riskiest organizations because False Claims Act applies to them, and a kickback statute, Stark, everything applies to government payers, whether it's state or federal. Those regulations apply to those rules. And then I say, okay, of that amount of money, which is your risk, that's what's at risk, how much are you willing to lose? Or how much are you willing to give back? 10%? 1%? 5%? Tell me what you want to do. Most of them say, well, nothing. And I said, absolutely. You don't want to give anything back, right? So if you're a $10 million company, let's say 90% of your business is Medicare. You're a $10 million company, which is small, right? That's $9 million of that goes to Medicare. You get that from Medicare. 10% of that's $900,000. Are you willing to lose 10% of that? Of course you're not. And on the average, when you think about compliance, it's really about protecting those profits that you have rightfully put into place, and that's what your ROI is. So when you think about what your ROI is and how do I think about putting a compliance program in place and what that budget looks like, really look at what your risk factors are, which is your government payers, and how much you're willing to put that at risk.
Let's get super specific. What does it actually cost when an organization doesn't invest in compliance?
So there's lots of different categories that those costs fall into, right? And I've got a few listed down here, so I'll probably look down at my notes. Direct costs associated with a compliance matter that's out there. That's repayments, that's fines, that's penalties, that's sanctions against an organization, as well as one of the biggest kind of direct costs that people don't really think about when they think about a compliance issue that comes out is being excluded from the federal health care program. That's not money out of your pocket right now. That's money out of your pocket forever and going forward. It's your inability to make more money. And so if the OIG or CMS or the DOJ decides that your violations are significant enough, they can say, we don't want you, we want you excluded. We want to exclude you from the federal health care program, right? The OIG, LEIE, list of excluded individuals and entities. They will actually put you on that list, which means that you cannot receive any dollars from the federal health care program going forward. When you're excluded, 60, 70% of your revenue that you were counting on from Medicare, TRICARE, or TRICARE Champus and or Medicaid goes away. Who's going to lose 60 to 70% of their revenue? Now, if your revenue from the federal government's 5, 10%, your risks are lower, just like I said in the last question. You identify what your risks are, how much you're willing to lose. If you're only billing 1 to 2% of Medicare and you feel like that's fine, I mean, okay. But if you have a substantial amount of revenue that comes from the federal government, you really need to understand what those direct costs could be, which includes exclusion. Now, your indirect costs are anything associated with fighting a matter, right? So your legal expenses, if you have a UPIC audit that you need to go get an expert consultant or auditor or have a law firm respond to an audit that's out there, or you have an excluded person that you need to have self-disclosure with the federal government, and you need to have a lawyer in place to be able to do that. Those kind of costs, even consulting costs to be able to help fight these matters, can be in the millions and millions of dollars just to be able to handle something that could have been prevented for a couple $1,000. You have these operational expenses too. The operational expenses related to kind of non-compliance or not having a compliance program is somebody else is going to have to take care of this matter, whether it is a COO, a director of operations, your CFO, your head of revenue cycle. Somebody's going to take time out of their day to do what they're doing, which is generally operationally, they're making money for the organization. They're making things work better and everybody following the rules. Finance is actually doing what finance does, and revenue cycles generating or getting that revenue in. And somebody's going to have to stop and take time to do the compliance work because there is work to be done in compliance. So the operational costs that people don't quite see are pretty substantial. And when we talk about this with our CEOs and our boards of directors, and they say things like, well, I'll just have so-and-so do it. One, it could be a conflict of interest that is not your protections anymore against your organization. Someone say, the fox is watching the hen house, and you can't actually do that. Or two, you literally have taken them away from what you really hired them to do in their specialty, in their role. And that's really important, and that is an operational cost. And lastly is this reputational risk and this reputational cost. The OIG, I understand what they do. There are partners when it comes to fighting fraud, waste, and abuse, and I love that. But they are never at a loss for publicizing any enforcement action that they can possibly do. If you don't believe me, go to the website, look up the OIG enforcement actions. We do it every day to see who's posted out there, and there's at least 10 people, entities, companies, whatever it may be, who are listed as being excluded, paying fines, whatever. So and there's press releases by the DOJ across the board. Love their press releases. We use those in our education to say this can happen to you, by the way. And so go read them. Once your name is out there, people start scratching their head. And whether it's patients, whether it's hospital systems, whether it's somebody you want to partner with, they start scratching their head and go, ooh, do I really want to have that be my partner, that company be my partner, that people who got in trouble for a cyber event or an OCR breach or a False Claims Act violation, or they hired an excluded person, or they settled on an anti-kickback statute issue. Everything becomes reputational and everybody hears about it. So you got to be really cautious about your reputational risk because it takes a lot of money to build that reputation up in the first place. It takes a lot more money to erase people's memory and make them understand that, oh, we are really a good guy, even though we paid $10 million over here in False Claims Act violations. We're still pretty good. And that, you don't need that. You don't need that kind of headache, and that kind of cost is pretty tremendous.
Isn't it like for every bad interaction you have with someone, it takes 7 other interactions to undo the experience?
No, it's exactly right. And same thing with first impressions, right? I mean, there's a reason that people talk about first impressions. Your first impressions mean everything. And if you make a bad first impression, people go, oh, God, I don't want to be friends with you. And then you have to try it over and over again. First impression, I really got along with this person. I really had a great time with them. You're going to want to be a part of their lives. You're going to want to be a part of it. And Susan and I talk about this all the time, is you should be surrounding yourselves with people who are making you better. Not necessarily you making everybody better, but you making you better. And that's the same thing with healthcare companies. They want to surround themselves with people who are doing better and making them better.
For sure, yes. This episode of the Compliance Advantage podcast is brought to you by Ronan Healthcare Compliance. At Ronan Healthcare Compliance, we believe in transforming healthcare compliance from a checkbox attitude to a strategic advantage. With decades of expertise, our team of consultants provides innovative solutions tailored to your organization's unique needs. We don't just help you meet your standards. We elevate your business, ensuring ethical practices are at the heart of what you do. Whether you're navigating complex regulations or seeking to enhance your compliance strategy, Ronan Healthcare Compliance is your partner in achieving excellence in healthcare compliance. Ronan Healthcare Compliance, redefining compliance, empowering leadership. Visit us at ronanhc.com to learn more. Now, back to the show. Can you give us a real world example, though, without naming names, of course?
Yeah, a laundry list of examples, and I'll tick through a few of them, protect the names too. There's a company out there that I kind of worked with for many years that biggest thing that they wanted to do was to grow. And growth is great, right? Especially in those worlds with private equity or some investors that are involved in healthcare. And we see that a lot lately. And that's why the OIG is really kind of pointing their finger at these investment firms that are getting into healthcare, which I'm very much in favor of them being in healthcare. But prior to that, this company that I know really went on an acquisition spree, buying up different companies that fell within their specialty on a very fast, large clip. Now, what they did was they purchased them. What they didn't do is compliance due diligence. And what happens when you don't do compliance due diligence and you're acquiring somebody who doesn't have a compliance program is you don't know what you don't know. And when we see compliance due diligence being done, it's really picking up rocks and trying to understand what those risk factors are. Well, this company did this for a number of years. And eventually what ended up happening was, since the OIG can do a 7-year look back when it comes to False Claims Act violations, many years after the acquisition, people started reporting bad deeds happened prior to the acquisition. And if you do a stock purchase, when it comes to an organization, you buy that liability when you buy that company. And so 8 corporate integrity agreements later, based upon prior acts from acquired entities, this company ended up spending a lot of money fixing compliance issues that were out there because they didn't do it up front. And it cost them a tremendous amount of money on the backside versus just doing the right thing with due diligence and having a compliance program up front. So that's a good example. Another example is we see companies that don't have a compliance program who may be in their, let's just say, 3rd round of a TPE, Targeted Probe and Educate. Well, if anybody knows anything about a Targeted Probe and Educate, there are 3 rounds of that, right? And the idea is to educate these providers every round to indicate whether or not you understand the compliance issues or the coding and billing issues so that you can fix them going forward. Well, the idea is to pass the first round. If you can, if you're great. If the idea is, if you didn't pass the first round, pass the second round because you fixed the problem. Well, once you get to about the 3rd round, you all of a sudden become a bad actor in their mind, And what they do is one thing is they say, hey, we're going to put you on a prepayment review or make a referral to the OIG because we think you're creating fraudulent actions. Neither one of those are good. And on a prepayment review, right, now when you submit a claim to Medicare or anything else, you actually just submit a piece of paper, a CMS 1500 or a HCFA form, to Medicare with the CPT code on it, and that's how you get paid. They don't see the records. They don't review the records. They just say, we take you upon your word to bill what you think is documented within your record, and we'll reimburse you on that. A prepayment review says, yeah, we'll take your piece of paper, but we're also going to take all the records too, and we're going to take our time reviewing those to make sure that it's correct, that the code that you build is code you're going to be reimbursed. Well, that hits a huge cash flow problem. Right? You don't get paid. You're going through all these reviews. You have a DSO issue, right? Day of sales outstanding, and you're not getting money in. So that's a huge problem. If you had a compliance program being involved in an active TPE, you could be arguing the point. You could be giving all the records right up front. You could be preventing going to those second or third rounds. And we see this a lot in a real life scenario. Another instances would be if you're not doing sanctions checking, which compliance programs do those on an annual or on a monthly basis, and because the OIG can exclude individuals every month if they need to. So when we look at that from a compliance standpoint, we are making sure that everybody who's with your company, whether you're an employee, contractor, or a vendor, is eligible to participate in the federal health care program. If, as an employer, you're hiring people who are not eligible to participate in the federal health care program, and they have some sort of task of helping a claim being billed, whether it's a coder, biller, scribe, provider, whatever it may be, all that money needs to be returned, or else it be considered a False Claims Act violation. So if you're not having an active compliance program, and we see this a lot, when we come in and we're doing, all of a sudden we do sanctions checking, we find an excluded provider, well, all that time period and all that money that you have billed for by this provider has to be returned. Then a lot of the times you have to report yourself to the OIG to do a self-disclosure to say, yeah, we hired somebody. Yes, we're giving our money back. Are there fines and penalties for hiring and employing somebody who's on the excluded parties list? And civil monetary penalties can kick into place to fine you for those reasons as well. And lastly, they can exclude you for hiring somebody who has been sanctioned and excluded from the federal health care program, and you're billing them anyways. And you have to go back 7 years, right? At least to the time period that the person was excluded. So those are real life examples that we deal with all the time that people just don't know, or they overlook it and they go, well, I don't need a compliance program. I don't need to do sanctions checking. I don't need to do auditing and monitoring. I don't need to worry about this TPE or respond to it. I don't need to do due diligence on this company. It's a small company, whatever it may be. And you're paying a 10 multiple on monies that you're going to have to give back because you didn't do compliance due diligence on it. And they just don't realize that is really an ROI or a cost savings that would really be important to spend $100,000 up front to prevent millions and millions of dollars in the back end.
We hope you enjoyed this first part in our 3-part series on compliance budgeting. Today we covered why the no budget objection is really about seeing compliance as a cost center, the true cost of compliance gaps, including direct penalties, legal expenses, and reputational harm, and real examples of what happens when organizations skip compliance due diligence. Stick around for part 2, where Ross introduces his game-changing 3 Ps framework: profit protection, preferred partner status, and patient trust equity. This shows you exactly how to build an effective compliance program, even with limited resources. You won't want to miss it.
Thank you for listening to today's episode of the Compliance Advantage podcast. If you enjoyed it, please rate, review, and share this episode with someone who might benefit from it. Don't forget to visit us at ronanhc.com for more resources and connect with us on social media for the latest updates. And remember, compliance pays dividends. Invest today.